Lately, a group of molecules has made progress against obesity. The so-called glucagon-like peptide -1 receptor analogues have proven to be effective in fat loss and metabolism improvement. But they have a very big and little discussed weakness. That weakness is what happens after stopping the drug. When any intervention aimed at improving obesity ends, there is a strong tendency to regain the lost weight. This tendency exists even after bariatric surgery, where there are modifications that are permanent anatomical changes, and there are not a few patients who after surgery regain the lost weight or develop other behavioral addictions. So we need something more than just medication or surgery. Even the best and most powerful molecule falls short when acting on its own. There's nothing we can give once or for a short period of time that will solve a problem as big as obesity for life. What is that something? I'll tell you right away. This video is crucial for overweight and obese individuals as well as health professionals. The information gathered in it comes from a wonderful and recent review article published in Nature by Javier Butragueño and Jonathan Ruiz. I recommend listening to our podcast episode with Javier about obesity. It's not to be missed. At the end of the video, I will give you an option so you can benefit from the combined effect of pharmacotherapy, training, nutrition, and psychology. But first, you need to have a clear understanding of what anti-obesity drugs are. They are molecules that mimic the action of the glucagon-like peptide, one hormone produced in the intestine and discovered in 1986 2 days ago. What does this hormone do, or what is it used for? This peptide has significant metabolic effects, typically involving generating a strong satiety response and improving insulin sensitivity, although it has many more. What we achieve with drugs, some are taken orally, others are applied subcutaneously, is to artificially but powerfully generate those same actions in your body. They are called glucagon-like peptide, one receptor agonist because they generate an agonism in that receptor, that is, they mimic the action of the natural hormone. Nowadays, there are already many different ones, and without mentioning trade names, you will recognize active ingredients such as liraglutide or semaglutide. The most novel ones generate a weight loss already comparable to bariatric surgery, which is totally surprising. However, like any drug, it has to be used properly, and above all, it should never be used in isolation. A series of interventions parallel to the action of the drug must be put into motion so that the entire intervention makes sense in the long term. This is the central message and key point of today's video. If you are a person who has used, is going to use, or is using these anti-obesity drugs, I'm going to explain why they will help you lose fat. But even more importantly, the reason why it is absolutely essential that you exercise if you want to be successful in the long term. And by success, I mean not going back to the starting line, that is, having the same health status as when you started, but having spent economic, psychological, and temporal resources. Let's examine the specific benefits of using these drugs. The first benefit, and the most obvious one, also the most sought after, is the reduction of mass fat by facilitating a sustained caloric deficit. You already know that in order to reduce your body fat, you need to create an energy imbalance in your body so that your accumulated fat covers that energy need. How do drugs get you to a caloric deficit? Well, it's very simple. They greatly reduce your appetite. And how do they reduce your appetite? They slow down gastric emptying and therefore the speed at which food is absorbed. By slowing down the digestive movement, if you overdo it with the amounts of food, you can have nausea or vomiting, which is a very common side effect, the most common in this group of drugs. They enhance pancreatic beta cell function, which produces insulin. This does not necessarily mean that there is greater insulin production, since weight loss and more progressive carbohydrate absorption usually require smaller amounts of insulin. This is what happens in the long run. The pancreas is relieved as it has to produce less insulin to meet the needs. Change in food preferences. This is a rarely discussed interesting topic. Glucagon-like peptide -1 has profound effects on the brain and modifies eating behavior, generally leading to healthier choices and reducing the desire for addictive substances such as alcohol, tobacco, sugar, or even opioid drugs. In this sense, they could have an anti-addictive effect. They reduce the risk of myocardial infarction and stroke in people with obesity. Glucagon-like peptide -1 also acts directly on the cardiovascular system. As you know, the cardiovascular risk is increased in people with obesity in a dose-dependent manner. Higher obesity levels mean increased risk. They improve your glycemic control. What is the mechanism by which we have said these molecules mainly work? It slows down gastric emptying and therefore the speed at which carbohydrates and the rest of the macronutrients are absorbed. This generates a lower insulin response and a lower glycemic response. It's as if by the mere fact of using them, we reduce the glycemic index of your diet in general. If glucose appears in the blood more progressively, we have to produce less insulin per unit of time to metabolize it. They reduce the metabolic adaptation after weight loss. What is metabolic adaptation? Your body progressively starts to spend less as you lose weight. The decrease in total daily energy expenditure is serious. It can be as much as 20 to 25% if you've managed to lose more than 10% of your initial weight. A person weighing 220 pounds who reduces to 194 pounds during an intervention, initially spending 2,500 calories to maintain weight, could be spending 2,000 calories or less after losing 1026 pounds. Well, glucagon-like peptide, 1 receptor analogues reduce this adaptation, which would facilitate the maintenance of the lost weight, at least through this pathway. Now, why is strength exercise the perfect ally of anti-obesity drugs? All these benefits that I have told you about come face to face with a problem that in the long term can seriously compromise the effectiveness of these drugs or the ability to improve your health. This problem is the loss of lean tissue. Losing lean tissue is the first step to disrupting your metabolism. But not only that, from a more positive perspective, physical exercise has many more synergies than you think with these molecules. Let's look at them. Exercise increases sensitivity to glucagon-like peptide -1, that is, it will make you more effective. Like every hormone with its receptors, your cells can be more or less sensitive to the action of hormones, as training the muscle regularly sensitizes your cells to the action of glucagon-like peptide, 1, sharpening even more all the benefits mentioned. It increases lean mass and bone density. If you are a person with little training, you start training and at the same time use these drugs, it is likely that you will achieve the desired body recomposition during the first months. I take this opportunity to remind you that these drugs have the indication or indications that they have obesity and type 2 diabetes fundamentally. That is, if you have a normal body mass index, you should not under any circumstances use these drugs. I was saying that you could simultaneously lose fat, gain muscle, and strengthen your bones, which is the exact goal. If you only use the drugs without training, what will happen? You'll lose fat, but also muscle and bone. It increases the transport of amino acids and glucose into the muscle, just like it sensitizes glucagon-like peptide. -1 strength training is the most potent intervention to help you get amino acids and glucose into the muscle cell. Getting amino acids in helps to allow recovery processes and muscle gain, and getting glucose in to cover the muscle's energy needs while improving your anabolic and metabolic environment. Minimizes lean mass loss secondary to caloric deficit. I never tire of saying it. If you don't train, 25% of all the weight you lose with any diet is muscle and bone. And if this happens, what happens? Well, what happens is that you will move less and less, you will be able to metabolize less glucose, you will have various osteomuscular pain, you will have a higher risk of fractures, you will destabilize your microbiota, and in a few decades you will be closer to functional dependence. High-intensity strength training can surprisingly reduce appetite, contrary to popular belief. Why? Because it reduces the production of ghrelin and increases the number of hormones that suppress appetite. Peptide tattoo pancreatic polypeptide, cholecystokinin, and glucagon-like peptide. 1. Strength training and glucagon-like peptide. 1 receptor analogues have a clear synergistic effect. While aerobic exercise at a moderate intensity offers many benefits, it often has the opposite effect. Now, how can you benefit from both pharmacology and training with professional help? Many of you need to improve your body composition for health reasons. As we discussed in the video, a compartmentalized approach where each professional on their own and without communication with the rest tries to help you has very limited results. This is something that we professionals see, as well as you, the patients, also see,